As Methodist Healthcare Ministry celebrated its 25-year history, it recognized opportunities to deepen the impact of the work it's been doing across South Texas. By sharpening its focus on health equity, Methodist Healthcare Ministry seeks to improve the health and well-being of both the people and places it serves. Health equity is the lens through which Methodist Healthcare Ministry seeks to reduce systemic barriers to health by supporting resilient individuals and families. This video series focuses on each of Methodist Healthcare Ministry's regions, sharing community voices whose stories shed light on the history of inequity in those regions, and the people and partners who are making strides to change it by going on a journey from charity toward equity and building self-sustaining, thriving communities.
The Valley, it is a very unique, very special place to live, and one where you can actually experience that true bicultural, community and that warmth.
I love the values, the traditions, and the people more than anything.
It's very similar when I visit families in Nicaragua, Honduras, and Cuba, in the Dominican Republic. Just the strong sense of community and filling in the gaps for each other and taking care of each other. I always use the phrase compañerismo because I'm part of this community, so I want to be with you.
We recognize that there's just such a need here, especially on the border. We see folks, you're not only just living paycheck to paycheck, just living day by day.
So like a lot of people see McAllen, where they're like, oh, McAllen's such a beautiful city, Edinburgh with the university and everything. Yeah, but if you drive 10 minutes in any which direction, you hit an area that's really isn't up and thriving. It's a community that's hit some hard times and needs help.
It was a bit of a culture shock. I won't say I haven't seen a lot of poor areas, but this was much more so. I think the multi-generational caring and concern are great, but they still don't have anything, and that's what's sad for me. It's sad to see families living like that.
It is well known that health disparities are driven by social and economic inequities. Poverty is front and center, and we're talking about, poverty not just income-wise, but education and employment and housing.
A lot of the jobs that are here are part-time jobs, manual labor like construction, farm workers that don't get the benefits of being able to still get paid when they're having to do or go to a medical appointment. Having the ability to just freely choose and say, I'm going to take this time to take care of myself is what plagues most of our community.
The mobile van is out in 14 colonias across the 4-county area. We have one location in Stark County, one location in Willacy County, and the other two are pretty much divided between Cameron and Hidalgo. And we take primary care to them. We are either at a church, or we're at a school, or we're at a community organization.
We try to promote a lot of medical literacy, a lot of patient education, a lot of patient empowerment, because we just feel like a more knowledgeable patient is a more empowered patient. Even with me going into the community, with the team going into the community, that they're like, well, no tengo alguien para llevarme. I don't have anybody to take me. Or, oh, pues dime cuándo para comenzar a juntarme dinero. Like, let me know in advance so I can start saving up money so I can put gas.
Aquí como se gana el dinero, se gasta, porque aquí todo es más caro que allá. Y aquí hay más hospitales, hay más especialistas, pero todo es muy caro.
I have a patient in Alamo, Texas, and she was approved by Indigent Care, that is her insurance, to receive 3 steroid injections for her back.
Y solamente me pusieron una, porque el condado sí las autoriza, pero el hospital no.
But because the indigent care program takes a good amount of time to be able to pay the hospital, they denied her the ability to get the other injections.
Pero como solamente me pudieron poner una inyección, nomás me duró 2 semanas el efecto. Ya no puedo andar tan activa como antes. Entonces se me disparó la presión, así en 80. Casi por cuello, no me podía parar, hija, de la cama. O sea, me quedé dormida y desperté como a las 3, 4 de la tarde y así. Y me quedé yo, ay, ¿pero qué me está pasando? Casi nunca me pasó eso a mí.
So that's just an example of, the way that we could change policies. If we know that it has been approved and we know that payment will be there, maybe it's not an immediate payment, why can't we do that? Why can't we provide the treatment for her?
We've been working really, really hard in trying to get agreements and, starting conversations with specialty physicians, specialty clinics, in order to bring that help to our uninsured patients.
Here in the Rio Grande Valley, we have several areas that are very, very poor. They lack basic infrastructure, and that's what we call colonias.
People that live in the colonias, they do pay taxes, and those taxes don't filter back to different services within their communities. They may not have clean water, they don't have paved streets, they don't have street lighting, they don't have garbage pickup.
So I think there's a lot of room to improve that in the valley and to help those communities, that as the valley grows, to pull those communities along with it.
One of the misconceptions that people may have is it's just the humanitarian element of it, that people are people. There's no distinction whether you're on this side of the community or the other side of the community, or you're across the border on this side of the border. Every single human being is made in God's image, and so it's our responsibility to treat others with dignity and respect. And so if we see someone, especially those living in a colonia that are in need, we should be proactive in helping them, especially with us and our blessings that we have, to hopefully pay it forward and make a difference in that community.
But you have to help them improve what they're returning to. So if you teach them how to do a low-fat diet, well, if you can't buy the food that does that, how do we expect them to eat a low-fat diet? So I think that it's just a product of the whole community to do that.
That's why we take the fresh produce that we get from our community partner border missions, because we want to promote healthy eating.
When we see folks in the colonias, eating junk food, and we're seeing, that creates, not only a problem at present, but systemically, down the road for generations. If we can kind of curtail that and say, hey, we have a solution with this high quality produce, we can kind of teach folks, this is the good stuff. We don't need to eat the processed stuff, and this is what God has given us, like from day one. So we should probably eat that.
Despite someone's socioeconomic standings, despite their income, despite their background, they're able and entitled to have the same level of good health care as everybody else. Because I am a firm believer that for some reason healthcare has become a luxury when it's not. It's something that saves people's lives, so why wouldn't everybody have access or prime access to healthcare?
I think health equity is just everyone having a fair opportunity or chance, a fair shot at being as healthy as can be. As I think also, as we say in Spanish, hacer el suelo parejo, or making sure that the ground is even for everybody, and that we're all able to part from there into being as healthy as everyone can be.
Man, what a great impact it would be if we could just lock arms with other people that are doing, the same thing or have the like mind. Okay, what's lacking and how can we fill the void? And so that's our hope, is to continue to build strong relationships to make a greater difference.